My name is Geoff Darcy. I'm director of the Darcy Wellness Clinic, acupuncturist and herbalist. And with me today in the studio are Arthur Gertler. Welcome, Arthur. Medical doctor extraordinaire. And Christopher Ali, who is with Douglas Labs, a manufacturer of advanced nutritional supplements. And today we want to talk about heart disease. So before we kick off, Arthur, would you just explain to us what is heart disease?
Well, the most common type of heart disease is what we all know of as arteriosclerosis or atherosclerosis, blockage of the coronary arteries because of arteriosclerosis, plaques of calcium and other substances that narrow the opening of the artery and eventually prevent enough blood flow into the muscle of the heart to cause a heart attack or angina.
So the cardiovascular disease, I think there's 79 million people suffering high blood pressure, 72 million Americans. Coronary heart disease is 15 million. Acute heart attack, it's just on and on. Why is this such a prevalent disease? Why is this the #1 killer of Americans? Why do you think?
Well, statistics, this question has been asked by public health officials many times, and there are more than enough statistics to show us that most of our heart disease, 80% of it, is caused by dietary and lifestyle indiscretions.
80%?
Yeah.
It could be preventable. So 80% of the people that we know who are dead due to heart disease or suffering from heart disease could be alive right now if they had started prevention early enough.
It's true.
Could you explain, what a heart attack is?
Yes. There we have the slide showing on the right-hand side the coronary artery with a yellow plaque that's almost completely blocking the flow of blood. When that becomes larger suddenly, either because of many different factors, of spasm of the wall of the artery with the muscle, the accumulation of sudden clot because of infection, inflammation, free radical damage or chemical damage to the plaque, clot can very quickly, acutely block the entire flow of blood in that artery to the subsequent muscle that it supplies, and we get a heart attack, a sudden death of heart tissue.
So you had mentioned damage from chemical or antioxidant to the plaque itself or to the artery itself. Can you just explain a little bit more about that?
Yes. We're referring here to the what's generally known as the term oxidative stress, which means free radicals. These are very chemically reactive groups that are generated by basically dietary indiscretion, too much refined sugar, too much animal fat, too much animal protein.
So all of that can lead to actually damaging, causing free radicals that actually damage the artery itself or interferes with the plaque.
That's right.
Yeah.
And along with those free radicals, it's interesting that heavy metals, which are present in many, many different types of food, alone will cause 1 million times the amount of free radicals to be generated in the blood than without them. So this is a very potent cause also that all of us.
Right, so I had heard that we don't generate our own antioxidants as such, whereas plants will generate antioxidants to protect themselves from the damaging rays of the sun, but human beings don't have the capability of managing antioxidants. So is that partially the dietary link to heart disease, that we're not getting enough plant-based antioxidants to protect ourselves with?
Well, I think we do have some natural antioxidants made by the liver, glutathione, and we have a very limited amount of other antioxidants, something called SOD. But it's true with the level of free radicals that we generate, we really do need a lot of extra help from outside in the form of plant antioxidant substances, many of which are very readily available to us.
And these plant-based antioxidants, these are the ones that combat the free radicals, that keep them in check and prevent damage, arterial damage. So you're a medical doctor, you've been in practice over 30 years, you've seen a lot of the suffering due to these types of damages. What are you generally recommending as a holistic physician these days? What are what's your short list that you make sure you cover with patients?
Well, it's really not too short, but I'll try to summarize it here. First, we go over all the lifestyle changes, proper exercise, and most of all, proper dietary habits. this does not sound as complicated or as severe as you might think.
Yeah.
Cleaning up the diet, getting the proper exercise, getting the proper sleep, rest, and trying to get stresses under control. Secondly, we perform standard blood tests that any medical doctor can perform to assess the risk factors. All the risk factors, cholesterol, risk factors of silent inflammation, and get a good history. And then we design a program with herbs and diet and lifestyle to fit the individual.
So herbs, diet, lifestyle, relaxation techniques, exercise, all of these are kind of more holistic ways of combating heart disease.
That's right.
Yeah, and they're complementary with regular care. That's so right. If you're under the care of a conventional cardiologist, you can also add in and cover the points that you cover with your patients as well.
Well, certainly.
Yeah.
Certainly.
So some of the factors that are involved with high cholesterol would be high consumption of animal protein, of high consumption of fats, and actually we can see from, the slide a healthy artery, which is unclogged, and then the beginning of that kind of cholesterol plaque building up, and then the severely restricted artery that can really be life-threatening. And
well, the inflammation, we mentioned dietary factors. Getting the diet under control is 9/10 of it.
yeah,
We also give various herbs, micronutrients, and vitamins. For example, niacin
yeah,
is very good to lower some of these factors. Omega-3 fish oils
yeah,
is anti-inflammatory. That lowers the CRP and the interleukin-6. Diet and exercise are very, very important in weight
Right.
reduction, getting
Right,
down to a
right,
normal
right.
weight.
The idea of the techniques that would be covered would be relaxation techniques, because stress can cause inflammatory responses in the body, make for a very acidic environment. Dietary changes, which we'll go over a bit more about. Of course, exercise. So exercise, diet, and relaxation, those three are already proven, are they not? Demonstrated in studies by Dean Ornish to reverse heart disease, not just prevent, but actually reverse plaquing. Could you
Right.
tell us a little bit about Dean Ornish's study?
Yeah, Dean Ornish took a group of cohorts with fairly advanced heart disease, and he put them on a very strict diet, pretty much what we're talking about here, the low animal, vegetarian diet,
Yeah.
with plenty of protein, but it was vegetarian protein, plenty of fresh fruits and vegetables, and over 6 months to a year, and some of these people went a year and a half, he actually showed vast clinical improvements in all the parameters of heart disease, including less chest pain with angina, less signs of shortness
So
of breath.
angina is where the blood supply to the heart is
Right.
restricted, and it causes pain, often down the left arm. Is that right?
That's right.
Yeah.
And these people were able to, most of these people were restricted to their homes or bedridden. Every single one of them was able to walk or even slowly jog or walk fast 3 to 4 miles at the end of the study.
First of all, thank you for having me here today.
You're very welcome.
I appreciate it. Basically, we look at it from dietary needs for the American.
So like an extension of diet.
Correct.
Good diet.
What do the American public? What are they lacking in?
Yeah.
What is successful in other areas of the world that we don't incorporate into our diets for
Right.
whatever reason? There's been several studies on Eskimos in Alaska with fish oil pertaining to heart disease, and that's part of their natural diet. They ingest fish on a regular basis
Right.
because it's part of their environment.
Namely arterial heart disease, cancer, arthritis, bone disease, osteoporosis in women, and many other neurologic diseases, Parkinson's disease.
It seems like almost the vegetable protein keeps the animal protein in check. There's studies that show the greater amounts of ingestion of plant-based proteins counterbalances and counteracts the animal protein. So when we actually stop eating plant-based diets, then it's like a double-edged sword. Not only are we getting the animal protein, but we're not getting the protection from the plant-based proteins as well.
Multivitamin is essential.
Yeah.
With a B complex. B complex, including folic acid, is has been proven through
So the
research.
idea of folic acid coming from leafy greens, if we're not getting the leafy greens, then at least get the multivitamin.
Correct.
Yeah.
It's recommended 5 servings of vegetables minimum, fruits and vegetables minimum per day.
Yeah.
Many people.
The Okinawans were actually up to 9 to 12 portions.
That's ideal.
Of vegetables a day that gave them the highest longevity in the world and 80% less heart disease than the U.S.
Co Q10 is in the last 10 years, has gotten some great research to back up its effects.
Yeah.
And with the statin drugs, in our bodies, our Co Q10 levels affect our energy levels.
Yeah.
And as we get older, our Co Q10 levels diminish. And with statin drugs, which many people are on nowadays, the levels of Co Q10 drop diminish even further.
Right.
So it's essential if you're on a statin drug to take a Co Q10 supplement.
I know that there's Dr. Sinatra, not the singer, but the medical doctor, has a protocol, right? The Sinatra protocol, which is magnesium, another big seller,
Magnesium
I imagine, for your
well.
company.
Yep.
So magnesium, L-carnitine, coenzyme Q10, and D-ribose. Maybe you could explain a little bit about how you use that protocol in your practice, Dr. Gertler.
Yeah, this is a very valuable and important program, especially in people with congestive heart failure, which the heart muscle is not getting enough blood, and it becomes flabby and it can't pump enough blood to the body. And what these 3 things do in concert, they all work on energy levels of the heart muscle very effectively. The Co Q10 increases the mitochondrial energy. The ribose
So
is
that's like the engine of the muscle, right? The mitochondria cell.
Right, right. It generates the energy which causes the muscle to be able to contract strongly.
Right.
The ribose does a similar thing, and the L-carnitine in a different way does the same thing. So you're getting 3 different ingredients, natural ingredients, which do the same thing to strengthen the heart muscle. It's very effective.
Right. So what we're talking about then is diet, getting a lot more fruits and vegetables into your diet, staying away from refined carbohydrates, refined foods in general, trying to keep at least to, as the China study would say, a 5% animal protein in your diet. Get most of your protein from a vegetable source, beans and grains, and then, so these are the common recommendations that you're making to your patients, along with relaxation, increased exercise. Dr. Gertler, holistic physician at the Darcy Wellness Clinic, and Christopher Alley, territory representative extraordinaire with Douglas Laboratories.
I didn't bring any sandwiches this time. I'm sorry.
Thanks very much for coming into the studio today. And just want to wrap up by saying that there are non-drug, non-surgical, natural alternatives for most diseases and illnesses. And in our series of Darcy Wellness programs, we want to cover specifically each one in the series of 8. We'll take out we'll approach the major illnesses that are commonly approached that can have a major difference made in your health. From us at Darcy Wellness Show, we want to wish you and your loved ones great health.